Gabby, tell me, what is insurance verification? I
Insur-
have Blue Cross Blue Shield. Am I a candidate for surgery?
So I have to get your name, your date of birth, and the ID number. I need to call your insurance and see if it's a covered benefit under your plan. I ask for certain procedure codes.
So it means that Blue Cross Blue Shield has different plans.
Yes.
Not everybody has the same plan, right?
No, not everybody. There's different Blue Cross, Blue Shield of Texas, of Alabama, Illinois.
And the same goes for Aetna, Cigna, United.
Healthcare, yes.
So it's not enough to have United.
No.
It depends what plan.
Yes.
And the only way for me to know if my insurance plan covers weight loss surgery is for it to be verified, right? To do
Yes.
insurance verification.
Yes.
Okay, now you do that, right?
Yes.
Or the patient can do it himself.
The patient can do it themselves, but the reps will only tell them yes, it's covered or no. They won't go into detail.
And when we call,
When I call, I make sure that the procedure codes and the diagnosis codes are covered under the plan, that it's not a policy exclusion, and I make sure that they tell me the deductible, the out-of-pocket, how much has been accumulated, and what's the patient's responsibility, so that way we can give them a quote of how much they have to pay for the surgery they decide to get done.
okay, so not only you verify if it covers or not, but you also check what is the financial responsibility of the patient, because the insurance doesn't cover everything.
No.
It covers a part. It's always maybe like a 10 or 15 or 20% part that the patient is responsible for. And in addition to whatever, it's called deductibles and copays, right?
Yes.
Yeah.
So whenever
So-
I call, they give me all that
That insurance information.
Yes.
And that number that you give the patient is an approximate number, correct?
Yes.
Because sometimes they may vary.
Yes.
Now, let's say my insurance plan is being verified and it covers weight loss surgery. How long does it take you to check that, and how long is it gonna take you to call me back with that information?
It can take up to 5 business days. When we call the insurances, it's really hard to it takes time to get a hold of a representative. So whenever we have a representative on the line, we try to cover all the United Healthcares we have, all the Blue Cross. So with one call, we can take down as many insurances as we can.
Because in the office, we sometimes have, 100 patients that we're verifying on a weekly basis.
Yeah.
We get calls not just from McAllen, Mission,
From out of town.
Brownsville. We get calls from Dallas, Houston, San Antonio, even from out of state.
Yes.
So some patients, and accordingly so, are anxious to have that answer, but sometimes we can't give them an answer because it takes a while, right? We're doing that every day, and we have people assigned, in this case you, who's just doing that,
Yes.
right?
And every insurance is different. Every insurance has a different prefix. Every prefix is a different number. It can be Blue Cross with a prefix of ZGP, PEX, or USB, anything
That's
like
the type
that.
of plan, right?
That's the type of plan. Each plan has a different number.
And what does that mean?
So that means that if I have a representative on the line for one Blue Cross, and I'll tell them, can you help me with another patient? So they'll check the prefix, and they're like, I'm sorry, but that's not our plan. So
you have to make another phone call and talk to somebody else.
Yes, so that's why
Yeah,
it takes
that's
long.
a tough job.
It takes time.
Okay, so let's say you're done, you have the information, you call back, and it does cover.
Mm-hmm.
So it's not just that. Yes, it covers.
Yes, no.
No, because each coverage is different, right? There's different requirements.
So
Can you tell me about
so
that?
at that time, I will call the patient back, and I would tell them, okay, this is what your insurance requires. Whether it needs weight loss documentation, a certain BMI. At that time, I'll go over with the patient and ask for the height, the weight, make sure that they meet the requirements, so that way they don't come here wasting their time. And then at the end, we tell them.
Yeah, because sometimes it's not just a body mass index or BMI of 35 or higher.
Mm-hmm.
Some insurance plans require for the patient to suffer from one or two medical conditions related to weight, like diabetes, high blood pressure, high cholesterol, sleep apnea, and things like that.
Yes.
So, and then what happens after that? Let's say the patient insurance covers and they meet requirements. What's the next step?
So then I'll tell them if they want to schedule an appointment to come consult with us. That way we can start the process, give them the referrals they need. We can send them to get their clearances.
Okay, wait. So they came to see me, Dr. Del Pino, and that's not it. Because after they see me, in the United States, everybody needs at least what evaluations before surgery?
The medical, the psych, and the dietitian evaluation.
Okay, that's the minimum. But some
Yes.
insurances have an extra requirement, and it's called medical weight loss treatment
Yes.
documentation.
Mhm.
What does that mean?
So every insurance is different. Some insurance require 3 months, 6 months, 12 months
Of
of medical weight loss documentation. That means that you have to be seeing a supervised
medical
medical
diet.
diet with your family doctor or a dietitian for consecutive months, depending on what they're requesting.
So you have to go see them on a monthly basis,
basis.
sometimes for 3 months.
Uh-huh.
Medicare is 4 months,
Months,
right?
yes.
Blue Cross, I think.
Some Blue Cross out of state is 6 months.
And
We've
then
had
United,
some, United is 6 months.
Medicaid is 6 months, right?
Aetna is 6 months.
Yeah. So can you imagine? Sometimes we have 200 people being worked up, and they need 6 months. It's impossible for us to keep track of that, even though we try. So
Yeah.
the patient is responsible for making sure they're going to those monthly visits, because if you miss a visit, then you're done.
You have to
Then
start
you're
over
gonna
again.
have to start over again with this 6 months of medical weight loss treatment documentation, right?
Yes.
Now, some insurances are even more complicated, like Medicaid, right?
Medicaid.
Because not only they require the 6 months, the medical, the psychology, and the dietary evaluations, but they also require for the patients to be seen by,
a cardiologist, a pulmonologist.
she's a heart doctor and a
Mhm.
lung doctor,
Yeah.
and they have to have
They
a sleep apnea test, right?
Yes, and they have to have the scope.
Which is a test where I put a camera that goes through your mouth to check your stomach from inside. It's called an upper endoscopy. Okay, and what happens after the patient has completed all this? You know, they came to see me, they did the medical psych evaluations, and then they did all this additional stuff, the medical weight loss treatment documentation. What's next?
So as they're bringing in the clearances, as I'm getting the clearances, I'll go ahead and start creating their chart. Once the chart's complete of everything that they need,
The package, right?
the package, we get it ready, you review it, and then we submit it to the insurance. At that point, I confirm with the patient what surgery they decided for. So that way, once I submit, it's really hard for me to change procedure codes.
Yeah, so what she's trying to say is that if we submit the package for a sleeve hysterectomy,
Mhm.
and you change your mind last time, we're gonna have to go through the application
Again.
process again.
Mhm.
So
So it's
you
gonna
can change
delay.
your mind, and it's okay, but you have to understand it's gonna take a while before we get the other surgery
Yes.
approved. And how long does it take for the insurance to approve a certain surgery after you send that package?
They normally have from 15 to 30 business days. They don't take the whole 30 days, but they've been taking at least 2 weeks to
So
send me the
you will take at
authorization.
least 2 weeks
Yes.
after they receive the package for them to approve the surgery.
Yes.
And what happens when we find out that they have been approved? What is the next step for the patient?
So at that time, I'll get the benefits. We'll get a surgery date so that way we can put them on their liquid diet prior to their surgery.
So everybody will be on a diet for 2
Diet.
weeks before the surgery once we know exactly when it's going to happen. And
Yes.
they're going to know,
And they'll know how much they have to pay for their procedure.
which is the co-pays and the deductibles,
Yes.
right? Once they pay,
Once they pay, we'll
they
go
have
ahead.
to, you schedule, but they have to go to the hospital, right?
Yes. So whatever quote we give them, it's only for the doctor's
Money-wise,
fees.
for the doctor's fee.
Yes. Any quote that they have to get for the hospital, they would have to contact the hospital because they do their own insurance verification. It's way different because we do verifications for a physician. They do verification for a facility.
Yeah, so
So
we
it's-
cannot tell the patient what the hospital is going to
Chart.
bill them or
Mhm.
charge them.
Yes.
There's no way.
Yes.
So those numbers you have to find out after you talk to the hospital.
Mhm.
And then they give you a number, we give you a number, you pay the money,
And then we'll,
but they still have to go through a registration process in the hospital after they paid the money.
Yes. So as
What is the registration process all about? What happens in the hospital? Let's talk about regional.
Okay, so regional, you have to go in there. You're gonna expect to be there at least 2 hours tops. They have you see a video of how your surgery is gonna be done, the pre-op and the post-op. They have you sign all your consents. You meet with the bariatric coordinator at the hospital,
Which is Jennifer.
and she'll give you the whole packet of after surgery, how you're gonna be eating, the portions, the foods,
The
your
diet.
do's and your don'ts, what diets you're going to be following. and pretty much they do the whole pre-op labs, any other little.
And that has to be done at least 1 day before surgery, correct?
Yes.
Yeah, because some patients don't do that, and they want to have surgery on a Friday. But if they didn't do all this lab work, watch a video, the surgery is not going to happen.
Yes. No.
Period.
Mm-hmm.
Yeah.
So
So if you're coming out of town and you're using insurance to have a surgery, you have to be in the hospital the day before to go through all this process.
Yes.
Okay.
Because they do have to go and meet with make sure that all the labs came out normal,
right? And they'll probably be seen by the anesthesiologist.
anesthesiologist. Yes.
Okay. And once they do all that,
And
they're ready to go.
The hospital will give the patient the time. We
the
do
surgery.
not give time.
Yeah. So it's not us.
No.
When they tell you show up at 6, 7 o'clock in the morning, that
not
the surgery
us.
doesn't happen. Believe me, I'm working there all day, and sometimes I think they call patients too early, but that's out of my control.
Yes,
Anyway.
no.
So
the hospital. So then the hospital will give them
and the last thing is for them to be nothing to eat after midnight.
the day before.
The only medications you're gonna stop are the blood
the
thinners.
blood thinners.
Okay, if you take medication for high blood pressure, you will take them the same day of surgery with a sip of water, and that's it. Any other advice or things that we missed? This is insurance proof of process with Gavi. She's our specialist. She's very patient. She's great. I really appreciate all the work she does here. Very smart girl. So treat her right. She's trying to help you. Sometimes, it's hard for her to give you a call back. If she doesn't, it's not on purpose. Just send me a message through Facebook or call our other number with Armando, who's the bariatric coordinator, because sometimes we have to take some, work off Gavi.